All right, good morning, everyone. Welcome. You are joining on live or replay right now to our West Valley Village gathering. And this morning, our topic is exploring home birth midwifery care. And I am just delighted to introduce you Maddison Baca. She is joining us today from the maybe central Phoenix area, if I remember that correctly. And she is a home birth midwife in the state of Arizona. So I want to tell you a little bit about Maddison to introduce her. She's an Arizona native. She loves living in the sunny desert with her husband and her one-year-old daughter, which I found out she's actually 17 months. So sweet, and she may wake up from her nap, just an FYI. She's always had a passion for women and knew she wanted to work in birth from a very young age. And she attended Grand Canyon University. She got her bachelor's of science in nursing there in 2016. And after spending about 3 years working in labor and delivery, she had a home birth with their daughter. And this was at the beginning of the coronavirus pandemic. So definitely some insight there, I'm sure, Maddison. And it inspired her to just leave that hospital setting completely. She then began her midwifery journey to help other women have a safe home birth. And now she's certified as a postpartum midwife and licensed midwife in Arizona. So welcome, Maddison. Thank you so much for being here. I'm just so excited to hear from you this morning about kind of those differences between midwifery care, especially in that home setting, and OBGYN care, and just how do those things differ? How do they parallel? And learn a lot today. So welcome.
Perfect. Thank you guys so much for having me. It's very exciting, and yeah, I'm excited to just kind of talk about everything. So you kind of introduced me perfectly and said everything I was kind of going to go through, but yeah, so I was born and raised here in Arizona. I've lived here my whole life. I went to Grand Canyon University, where I got my bachelor's of science in nursing, and graduated there in 2016. And then right after that, I started working in the hospital as a postpartum nurse. And I spent about a year doing that. And then I went into labor and delivery, where I got to help mamas with all sorts of their births in the hospital setting. So whether that be with an epidural or unmedicated or having a C-section, I got to do a lot of that. And then at the time, I worked all throughout my pregnancy and was planning on delivering at the hospital that I worked at. And then COVID hit and everything kind of changed. The restrictions in the hospital. I had always wanted to deliver without an epidural, and my mom has been a doula in the Valley for almost 10 years. And so I knew that it was important to me to have her there, not only as my mom, but as one of my support people. And about a week and a half before I ended up delivering, the hospital started implementing a ton of restrictions, and basically said that we could only have one support person. And so that meant I wasn't going to be able to have the support of my mom there. At the time, there were some hospitals in the East Coast that were starting to restrict even visitors at all. And so I wasn't even sure if with all the restrictions changing so much on the daily, if I was even going to be able to have my husband with me in the hospital. And I had known people who had home births before. I had attended home births before, but kind of believed the lie that you should have your first baby in a hospital and then have home births later on. And so it wasn't until the hospitals started implementing those restrictions that I really was like, okay, what am I going to do? And I ended up deciding just a few days before I ended up delivering that I was going to have a home birth. So it was a crazy decision, but it completely changed my life. So I always loved supporting women unmedicated when I worked in the hospital. But after my home birth, I realized, oh my gosh, more low risk women should be able to have their babies at home. Like, why aren't more people doing this? And so that's what kind of brought me to becoming a home birth midwife. I started my apprenticeship with Yetta Anderson, who I work closely with now and love so much, and just kind of dove in really deep with her, which was difficult as a freshly postpartum mom and still breastfeeding. We're still breastfeeding at 17 months now. So it was a lot of hard work, but it was totally worth it. So the first two things I want to touch on a little bit is the differences in midwifery certifications that you can get. So there's a certified professional midwife, which is what I am, and then there's certified nurse midwives. So CPMs usually are done through an apprenticeship model. We are certified through NARM, which is the North American Registry of Midwives. And there is schooling programs that you can go through, but it's primarily focused on apprenticeship model and learning through a preceptor. And so that's what I did. And then there's certified nurse midwives who have a nursing degree and RN beforehand. And then you go back to school and it's like a master's degree, and you're certified through the medical board. So the main differences is that, and then what your scope of practice is. So CPMs do primarily birth center and home birth, whereas certified nurse midwives, usually we see them more in the hospital setting, working alongside an OB, which they are amazing options if you're looking for a hospital birth. You still kind of get that midwifery care, but in a hospital setting. And then certified nurse midwives have a little bit more privileges when it comes to prescribing medications and things like that, whereas certified professional midwives do not. As far as CPM care and midwifery care goes, starting with prenatal care, it's all the same that they do in the hospital setting in a typical OBGYN's office. So we see our clients usually starting at the very beginning of their pregnancy, and we see them every 4 weeks until they hit the third trimester, and then every other week until 36 weeks, and then every week until they deliver. Women are allowed to have home births in the state of Arizona between 36 weeks and 41 weeks and 6 days. Once you hit 42 weeks, then we have to transfer care back to a hospital provider. So there's a wide range of time in which you can have your home birth. Your prenatal care usually looks different than a OB setting because it's either taking place in your home or in a more intimate setting in an office space. And we like to leave about an hour for your prenatal appointment so that we really get to build a strong relationship with you and really spend time getting to know you and what it is that you want for your birth and making sure that you feel heard. And I think that's one of the main differences between OB care and midwifery care is really building that relationship with somebody. And so like a lot of my clients, I consider friends, and I love them so much by the time they have their baby because I know you on such a personal level. And birth is so personal. So don't you want the person that's in that space with you to be so, you don't want them to feel like a stranger to you. So I love that so much about midwifery care. And then during your prenatal care, we offer basically all of the same tests and things like that during your prenatal care as they do in the OB's office, so that we can make sure that you are a good candidate for home birth and that you continue to stay low risk. So usually if you need an ultrasound or anatomy scan, we refer you out to somebody for those, but we're still able to read those and do lab work. We can do screening for gestational diabetes and GBS and all of the same things. But we usually offer more options and things like that. So that gestational diabetes screening, glucola drink that you usually drink in an OB's office, we offer some different alternatives for that. And most of what we do is focused so much on informed consent and making sure that you are fully educated on everything that is being offered to you, so that you have the right to refuse anything that you don't feel comfortable with for your body and your baby. And we're here to offer you alternatives and support you in whatever decision it is that you're making, so that you and your baby can still be safe, but as comfortable and what you feel best for your body and your baby and your birth. During labor and birth, that's obviously very different because you just stay right in your home. So we bring pretty much all of the same equipment to your home that they have at the hospital. So we're monitoring the baby, doing your vitals. We bring everything to your home in case of an emergency situation. All of us are trained in CPR for you and neonatal resuscitation for your baby. So we're always prepared in case there's an emergency that happens. But a lot of your labor and birth looks different because we're very hands-off in terms of intervening, but very hands-on when it comes to support. So in a hospital setting, your OB might pop in a couple of times to say, hey, or tell you they're going to check your cervix or start Pitocin or whatever. And then you see them at the very end for your delivery and they catch your baby and deliver your placenta and say, see ya, we're out of here and check on you tomorrow. So most of your care is done with your nurses and you don't really see your OB very much during your labor, except for the actual delivery most of the time. And so we're there with you through that active labor, through that entire birthing process, and then those crucial hours postpartum, we're there to help you. So very hands-on with labor and support, but very hands-off when it comes to intervening. We really, really believe that birth is the safest when we leave it to do what your body is doing on its own, and just really monitor you based on that and keeping you safe, but making sure that your body is, progressing on its own and doing everything. So then postpartum care, usually we stick around for a few hours postpartum. At the minimum, to make sure that both you and your baby are stable, that breastfeeding is established, that your bleeding looks good, that you've gotten something to eat, you've gotten up to shower and pee, and you're comfortable. And then you get tucked into bed, and then we leave your home and you get to just stay in bed with your family. And then the main differences and what I love so much about midwifery care versus your OB care is the support you're going to get when you're fresh postpartum. So I come back to your home at 24 hours, about 72 hours after birth, and then again about a week postpartum. And we're in communication through that whole week. But you're getting somebody that comes into your home to check on you and your baby so that you get to focus on staying in bed and resting and healing and eating good food and nursing your baby, and that you have the support for all of that. So we help with breastfeeding, but we're not experts. So we like to refer out and have amazing IBCLCs that we refer to that can come to your home. And we really focus on knowing people in our community who are experts in what they do so that we can make the best referrals for people. But seeing you a lot in that first week is so crucial for healing and making sure that you and your baby are adjusting well to that new postpartum life. And we're able to provide care for you and your newborn for the first 6 weeks. In the state of Arizona, which is so, so nice, because we talk about the first 40 days postpartum and how crucial that is for our healing of our body and establishing breastfeeding and our pelvic floor and so much of that. And so really for the first 6 weeks, you don't have to go anywhere. You don't have to take your baby to the pediatrician unless we're concerned about something. We are doing that care and in communication with you for those first 6 weeks, which is so amazing. So that's kind of the rundown on what we do in, my practice, and usually what Yetta does as well, and how we kind of work through prenatal care and labor and birth and our postpartum care for our mamas. And how that differs, from the typical OB setting, and really just giving that extra love and support to all mamas and making sure that they're feeling like they're our only clients when they are indeed not. Yeah, so I kind of rambled and talked a lot, but if anybody has any questions about anything, or questions about OB care or midwifery care, I'd love to answer any questions.
Thank you so much, Maddison. I love that overview, and I really appreciated the breakdown of the differences between certifications, because I think when we hear midwife, we don't necessarily make those designations in our head, and so it's nice to be more informed about the fact that the scope of practice is just not the same there. And that's not necessarily a detriment to your care. It just means that there's different capabilities of each different designation. So I appreciate that. Thank you for sharing.
Of course.
So at this point, like you said, Maddison, we are open for questions. Anybody on Facebook who is watching this live, you are welcome to put your comments down and we will relay those to Maddison. Anybody here on the Zoom, you are welcome to share. Just know that we are on Facebook Live. And just pop in there. You can do it in the chat. You can unmute yourself if you would like and just speak it out loud. But we're just going to open up this time for some Q&A. So anybody want to go first or have a question that they're wanting to ask? Anybody? I have one in my brain, so if no one else wants to ask something. Okay, I'm going to ask you, what is the alternative to that nasty glucose drink? I need to know.
Yeah, so in a OB's setting, so if you drink the glucola drink, then they check your blood sugar via a lab draw, and about an hour after you finish that drink. So then if you fail that drink, they would typically have you do a 3-hour, and then depending on the results of that, they would have you do a food journal and check your blood sugars at home to really see kind of what's going on. So rather than drinking the glucola and seeing what happens with that and then going to the 3-hour test, we jumped straight to just checking your blood sugars at home. So we have mamas designate a day, usually between 28 and 30 weeks, about where they check their fasting blood sugar in the morning and then eat a nice big breakfast, and about 2 hours after they finish eating their breakfast, then they'll check their blood sugar again and then report those numbers to us so that we can kind of see what their body's doing and how it's responding to food that they're eating on a regular basis, and what's normal for their bodies, rather than the glucola drink that you chug in 5 minutes. So yeah, and most of our moms will choose to do that food journal and, investigate their fasting blood sugars and then their postprandial blood sugars. And then that tells me, how their body's doing with food that they're eating on a regular basis. So yeah, I usually prefer that.
I love that. That's brilliant. And now I'm regretting drinking 5 of those. 4 of those.
No.
4 of those. Oh, if only, right?
They just they don't taste good and they make you feel like crap. I'm
They
like,
do.
you sit there while you're waiting for your blood to be drawn for that hour and you're like shaking and you're nauseous because there's so much sugar and you never actually drink that much sugar in under 5 minutes ever.
No.
And so your body, you can tell, is just like overloaded and your pancreas is working like crazy to like figure out how to, make your body better. Yeah.
Yeah.
I saw that LabCorp recently released a alternative to the glucola drink. I don't know a whole lot about it yet, but it's like a more natural version, and it's like an organic lemonade type thing. I don't know how long it's been around, but I just recently heard about it, and I've heard some good things about that as well too. So that's an option that I'm going to kind of start researching and investigating a little bit, so that we have another alternative for mamas if they want something a little bit more definitive.
Yeah, options are always good. And I think that's one of the really beautiful things about midwifery care, as you've been talking, that has been striking me, is just there's a lot more ways to choose to go about your care. And given what you've said about how you basically have everything that's offered by your OBGYN, but that support and the way that it's outlined across your prepartum, right? Like, and then preconception, even if you're working with somebody, and then throughout your pregnancy, and then throughout your postpartum for those first 6 weeks, just sounds very different and very much more laid back and tuned into you as an individual, which is really, really beautiful as an option for care for the people that want that, right?
Yeah, it's always important to us that our moms feel like they are in charge of their care. It's easy sometimes when you're going to a doctor's office and OBGYN who is just used to doing the things the way that they're used to doing them, that a lot of their verbiage may be, we are going to do this, or you have to do this, or rather than providing you the information and then the mom making the decision that's best for her and feeling like she's really the one that's in charge of her care. It's her body, and as the mom, you have hired this person, and so really as the mom, you are in charge and you get to make the decisions, rather than an OB telling you what is going to be done to you. So we focus a lot on education and informed consent, and
that autonomy of the parent, right?
Mm-hmm.
Well, from Facebook, Ashley Anders says she loves you.
Oh, Ashley's one of our birth assistants. We love her. Love you, Ash.
Excellent. And then I have a question in the chat. This is regarding insurance and payments. So what methods of payment for birth what are the methods of payment for birth in this way? And then what about insurance? Is access accepted, or do you have payment plans, a sliding scale? Can you tell us a little bit about how that looks for you, and if you're aware of how perhaps other practices kind of navigate that angle of things?
Yeah, so every practice is going to be different. Like every home birth midwife may operate a little bit differently. I will say that what I know for myself and the majority of midwives is that we usually it's through a self-pay. So you pay your midwife. We're usually out of network, and depending on your insurance, we may or may not be covered, but we don't bill insurance. So typically we have a cost, and then depending on who your midwife is, we work out payment plans. So we usually require, a set amount as our deposit, which secures your spot on my calendar, since we only take a certain number of patients per month based on your guest date, your due date. And And then we work on a payment plan or some sort of, whatever works best for you, usually paid in by 36 weeks because that's when we go on call for the birth. And then at the end of your 6 weeks of care, I provide my clients with a super bill and the codes and stuff for insurance to show everything that we did. And then you can go back and submit that to your insurance and see kind of what you can get reimbursed for. I have had some clients have a lot of luck with that, or reaching out to their insurance while they're still pregnant and saying, what do you cover for home birth? What do you not cover for home birth or midwifery care? And it just kind of depends on what insurance you have. I know that because of COVID, a lot of insurances have started maybe covering home birth where they might not have before, just depending on your plan, because the options of delivering in a hospital might not be as, available, or something that person's choosing or whatever. So people have had luck getting some money reimbursed from insurance, but it's kind of an extra bonus. Mamas, we always tell them, you have to really want home birth enough that even if you don't get any of your money back, it's still worth it to you. I will say though, that most of the time home birth ends up costing about the same or less than your bill would for a hospital setting, depending on your insurance plan. So even a normal vaginal birth at a hospital, depending on your insurance, can still cost you, $10,000+ and so sometimes home birth is even a much more affordable option, depending on your deductible or your insurance plan, or how much it's going to cost for a hospital. So that's something to look into. Yeah.
Excellent. All right. What other questions? Do we have anything from Facebook, Megan? No, not right now. Okay. How about anybody on our Zoom? Any questions you have about midwifery care in general, maybe specifics that you're curious about? Jenny, I see you. I see you prepping for your question there.
I mean, I know, a lot of people may have questions or thoughts about safety for home birth, right? So I just wonder if you could just address that just a little bit. I mean, I know the answer, but I know that also, that this is one of the questions that we had on our minds when we were looking at, a place to have a baby. So yeah.
Yeah.
And being a nurse, I think that gives you a little bit more perspective as well too. So yeah.
Yeah. So I think my background in labor and delivery nursing has helped me so much with this, because I really got to see so many different kinds of birth in the hospital, and like very low intervention births and super high intervention births and very emergent situations. And all of our moms that have home births are low risk. So they're usually very healthy. We do a lot of not intense is the word, but we do really good prenatal care and focus a lot on making sure that you're safe and that you're a good candidate for home birth in the first place, which is one of the big things. And then the second is that most emergencies in labor and delivery happen due to interventions. And so when we're not intervening and we're hands off and we're letting the body follow its natural process, emergencies don't happen as often. Of course, they still can, and sometimes they still do. Sometimes we have babies that don't tolerate labor very well, or there's things that arise during labor that it's just not safe anymore to stay at home. And so I think one of the things that is so important when looking for your midwife is really finding somebody who's humble enough to know that we can't promise anybody a home birth, and that your safety and your baby's safety is their number one priority, and that they're never afraid to make the call if it's no longer safe to be at home. And then the other thing too is emergencies in labor and delivery don't usually just happen at the flip of a switch. There's a lot of things leading up to something and so we as midwives really focus on critical thinking and looking at the whole picture the whole time, from the very first second we arrive at you in labor, and really before that in all the communication that we're doing with you. So if there's something that seems off, or baby isn't really tolerating labor, or your vitals aren't stable, or we're having excessive bleeding during labor, just different things like that, we're watching so that we have the opportunity to make the call for a transfer before in its emergent situation. So I always thank God that I've never had to call 911 for a mom in labor before, and hopefully that doesn't happen anytime soon. But all of the transfers that I've ever had to do for women in labor, I would say the majority of them are, first of all, for maternal exhaustion, and mom's ready. She's had a long labor and she needs an epidural, and that's totally fine. But my transfers that happen like that, or even for something where it's no longer safe, happen in a really calm environment, and having a good relationship with the provider in the hospital is so helpful that accepts our transfers, so that if we do need to transfer, the hospital is aware that you're coming, they're ready for you. I know you're going to a good provider. You go in your own car, you get to drive there, and it's not like a crazy situation where it's an emergent situation and we're calling 911, and there's all of these paramedics come in and do things like that happen sometimes, because emergencies can happen, but we focus so much on the leading events that happen up to that, so that we're able to make the call for a transfer beforehand, before it gets to that super emergent situation. So
yeah, thank you for that. And
yeah.
I've been delighted to see, even in the past 8 years or so, that there's been so much more collaboration between the providers that deliver at the hospital and home birth providers. That's huge, right? That's huge for everybody, especially for those mamas to know that, if they go to the hospital, that your midwife knows that provider, and that they'll be safe and they'll be taken care of, and all of that. So I think that's just another piece that's wonderful. So thank you for addressing that.
Yeah, of course. And definitely that's something that, if mamas are interested in a home birth and, they're talking to different midwives, find somebody that you really connect with. But that's one of the things to ask the midwife that you're talking to is, do you have a good working relationship with a provider who works in a hospital, who is willing to see me if there's things that come up during my pregnancy that may need a consultation, or during labor, what is your plan for transfer? Who do I go to? Where do I go to? Are they going to support me in making decisions and still give me that autonomy over my birth? Are they, going to still be supportive of the fact that I tried to have this home birth, or am I going to be shamed for making that decision to try and have a home birth? And so making sure that your midwife has a good working relationship with a provider that works in a hospital is, I think, so crucial.
Yeah.
Yeah.
Oh, go ahead, Jenny. I'm sorry.
Oh, no, I have another question, but go ahead, Sarah. I'm monopolizing the conversation.
Oh, well, I was going to ask something. So kind of twofold. So yeah, you mentioned a few things about those kind of leading events to a potential transfer. What are some common reasons why you might need to transfer, I guess, is my question. And then with that transfer, and I think I've deduced that you're not going with them, but do some midwives have the rights to be traveling with you or meeting you at the hospital, and then also help care for you in the labor continuing at the hospital versus in your home if there is a need for a transfer? Does that make sense?
Yes, it does make sense.
Okay.
So some of the things that might, you know, end up being a transfer during labor. So per the state of Arizona, we have a very, very long list of things that, you know, require a consultation or a transfer where we're automatically risked out. But then there's a lot of the things too that just, you know, are for us that we notice that it's not safe anymore. So just a couple of those things would be babies having decels and not tolerating labor anymore, and is not responding well to, you know, position changes or pushing and things like that. So if a baby's having decels during labor, obviously that's something, depending on the decels and how they're recovering and how long they've been happening, then that could, you know, result in a transfer, depending on baby's heart tones. Another thing would just
for new families who might not know what that means, can you define
yes.
what a B-cell is?
Yes, so that's when at some point during the labor, whether it be associated with a contraction or not with a contraction, the baby's heart rate drops and then comes back up. So it can be very subtle. It can be, you know, what we call like a variable decel, where it drops pretty low, but then comes back up pretty quickly, and more of like a V shape if you're thinking in terms of the numbers. So obviously we want baby's heart rate to stay good during the contractions, and most of the time it is. And sometimes we have some decels or decelerations during pushing, and that's normal because as baby gets squeezed going through that birth canal, it's really tight and stressful for them. But they're pretty close to delivery after that, and then they do pretty well. So it depends every birth, and you make the call based on that. And then another thing would just be if mom's vitals aren't stable anymore. So if her, you know, blood pressure is elevated, if she's showing signs of preeclampsia, usually that happens prenatally, but occasionally during labor and delivery, it's just mom is showing us signs that she's not stable anymore. If the bag of water breaks and we have thick meconium, where that means that the baby has had a stool on the inside still, then that can result in a transfer depending on how thick the meconium is. That usually will tell us that at some point baby was in some sort of distress, depending on their gestational age. So that's something that would result in a transfer. Those are like the biggest main things. Maybe if mom was having excessive vaginal bleeding during labor where it's not really expected, it would cause some concern for maybe some sort of placenta abruption, where the placenta is separating from the wall of the uterus before delivery. Usually if that's happening, we would also see the decelerations in the baby's heart rate. So there's a lot of things leading, like, you know, that result in that. And then your second question. So with COVID, it's hard because the visitors and the restrictions. So if like pre-COVID, if we had the ability to go with a mom during a transfer, then we would do that if we could. But we don't have privileges in the hospital. So when we go with them to the hospital, if we do during that setting, then we're there just as a support person. So we don't make decisions about their care, but we are there to just continue to help educate them and advocate for them, so that they can still, you know, have autonomy over their birth. But we don't do the delivery in the hospital. We are no longer considered their care provider. We're just more there, you know, as a friend and a support person, since we did build this relationship with them. Unfortunately, with COVID right now, most of the time our transfers look like we're sending you to the hospital with your, you know, your husband, or hopefully your doula also, and we're going to stay in contact with you guys, and then you know, come check on you and see you postpartum still, and just continue to really love on them even after they come home from the hospital.
Thank you. That's awesome.
Yeah.
Thanks for answering our questions. Does anybody else in either Facebook watching live or in our Zoom have questions for Maddison regarding home birth, midwifery practices? Do you have to give birth in a pool? What happens if you start pushing on the toilet? Does being pregnant with multiples automatically exclude you from home birth? What other questions do we have? Like, I mean, I'm just
rambling them off.
Just rambling off questions,
Yeah.
right? Like,
so
do you have to continuously be monitored in your home, or can you get up and walk around? Do you bring IVs with you? Right? Tell us everything. Tell us
all out.
I was
So
gonna say, Sarah,
we let you labor around your house, and you're free to do, kind of whatever you want in whatever positions and what feels best for you. So sometimes we have moms go on walks outside to get labor going more, or just have a change of scenery. If you start pushing on the toilet, then we have caught babies over the toilet before. Sometimes we'll try and move and get out of the bathroom if we can, but it just kind of depends. You don't have to have a water birth. We have lots of moms who labor in the tub and use that hydrotherapy for pain. We have lots of women choose to stay in the tub for delivery, and some who don't want to, or I personally labored in the tub for most of my delivery, but then when it came time to pushing, I just didn't really feel grounded in the water, and so I chose to get out and had my baby on my bed. But we kind of just follow the mama, so whatever she feels led to do based on her body's intuition, and most of the time it's just kind of whatever she's doing, then we just kind of follow her there. We monitor baby with a Doppler, so just intermittently we come in and listen before, during, and after a contraction, and then we just do that at different intervals depending on what time, what stage of labor you're in, listening a lot more frequently as we get closer to delivery and during pushing. We do bring IV supplies with us to the birth. One of the great things about my RN license is that does allow me to administer those IVs as long as I have, a written doctor's order, which we usually have, standing orders for our patients, so that if they need IVs, then I can administer those. Same things with antibiotics. If mom needs antibiotics for GBS, we have them do a consult with the doctor to get the prescription for the antibiotics, and then I can administer those during labor. We can do it as a saline lock or just a quick IV start, administer them, and then take it out. Just kind of depends whatever they want.
I'm super impressed at how you're tracking these questions. I'm like,
I know, I was like, what
is on it?
I lost the last one.
This is great. I don't even remember. Multiples. And then I also have a question in the chat. So can you deliver multiples at home?
So certified professional midwives, it is out of our scope to deliver multiples at home, but certified nurse midwives can. So depending on you just have to find, a CNM who does births, who does home births. So
I'm having any more multiples, but
no twins over here, please.
Oh, brother. Okay. Question from the chat.
Yes.
Somebody joined a little bit later, and so they wanted to know what options would be available to someone who has previously been borderline high risk and had to deliver in hospital before.
So it just kind of depends. There's some things that automatically risk you out that do not allow you to have a home birth. So one thing for certified professional midwives is if you are a VBAC, you can only have had one prior C-section. If you have had 2 prior C-sections, then that risks you out and I'm not able to provide care for you. A certified nurse midwife could choose to have a home birth with you if that's something you chose. So a CPM could not, but a CNM could. And then Sorry, I'm getting an update on my mom's in labor.
Okay, so just FYI, Madison has 2 moms.
Yes, we have 2 moms in labor
right now. So we will absolutely.
We're good right now, but yeah.
To check on those updates. This is part of her job description.
Yes.
So yeah. So when you're done with that, and so for the folks who joined a little bit later, there's differences that Maddison kind of outlined at the beginning. A certified professional midwife versus a certified nurse midwife, having different designations of scopes of care. And so there's certain things that Maddison can do as a certified professional midwife, but there's certain things that then would require a transfer or a certified nurse midwife to take over care should those things be met. And so one of them was, the question in the chat is, gotcha. Okay, I think I explained her question. Great. Okay. Yes, and we wish those mamas and babies the best, those families the best in their births. We're glad that you're there to support them through it. Yes, they're going to come on their own time, right? They're not.
Yes, they do.
But gorgeous and beautiful, and hopefully their births will be all that they can be, and all that they desire. All right. What other questions do you all have? Any questions? Feel free to not talk out loud if that's concerning to you. We will be popping off of Facebook in just a little while. So if you do have questions that are more personal that you want to ask off of Facebook Live, we will absolutely be giving you an opportunity to do so.
I have a question, and I apologize since I came in super late, so if this was something already talked about, but what's a typical like postpartum care look like in those first weeks?
Yeah, so right after the birth, we typically stay for a few hours at minimum to make sure that mom and baby are stable, breastfeeding is established, mom's gotten, up to shower and pee, and she's gotten food in her. And then I come back about 24 hours postpartum, give or take, depending on what time we delivered at. And then again around day 3 and then day 7. And then between day 7 and 6 weeks, we kind of just are in communication with how things are going. Do you feel like you need extra support? Do you feel like you need a visit? But those 3 visits in the first week are usually what is the most crucial, with making sure that your body is healing properly, your bleeding is going, is starting to go down, breastfeeding is going well, baby is, not too jaundiced, baby's gaining weight back, and all of that, those types of things. We do the newborn screening if mom and dad want to do that, both of those. So we're allowed to provide care for you and baby for the first 6 weeks postpartum, so offer all the same things that they do, at the pediatrician's office and such. So our primary focus postpartum is especially a lot during that first week, but up for the first 6 weeks.
I think I hear you, babe.
Yeah, she just woke up. I'll probably go grab her in a second.
I do have a few questions coming through in the chat now. Question: what are your routine newborn procedures immediately following birth, such as skin to skin, delayed cord clamping, newborn exams?
Yeah, so all of those. So as soon as baby comes out, baby goes right skin to skin with mama, and they stay there. Typically, we leave the cord pulsing until the placenta is delivered. So they get all of their blood that is available to them. Babies are actually born with 1/3 of their blood still in their placenta. So allowing that cord to keep pulsing until it's done just gives baby their entire blood volume. So skin to skin, delayed cord clamping until the placenta is delivered. And then that's pretty much where baby stays for at least an hour, usually more though, so that breastfeeding can be initiated. like if mom delivered in the tub, then we would either move to the bed before the placenta or deliver the placenta in the water, and then, cut baby's cord and have baby skin to skin with dad while we move mom from the tub into her bed, just for her safety. And then, but yeah, so baby's skin to skin that whole time. And then after, usually an hour and a half, I would say, usually after delivery, sometimes closer to 2 hours, then we would do the newborn exam right there on the bed next to mom. And then we do weights and measurements. We like to weigh baby with our old-fashioned scale and our sling, so we usually have dad help with that. And then we do offer vitamin K, so moms can choose if they would like their baby to have the vitamin K injection or drops, or refuse it altogether. So we usually do that right there with the newborn exam as well, with the weights and measurements. And then pretty much as soon as we're done with that, baby goes right back to mama.
Awesome. Thank you so much, Maddison. Yeah. So we have a couple more minutes where we're going to stay live on Facebook. And I need to share some news. Maddison, I know you heard your little one. So if you at any point around now need to go get her,
I'm going to go grab her.
This would be a beautiful time, just to give you that out. So I am actually going to be leaving the lead role for the West Valley Village. I know this might come as a surprise to some of you. I am definitely going to miss being here with you all, and I will try to pop in on the calls as much as I can. I am going to be handing off the West Valley Village today to Jenny. And she is going to be taking over in the interim. I would just love to put the word out to all of you, either in our Zoom room or on Facebook, that we are looking for village leaders to do what I've been doing. This is a really fun role. If you have any questions for me about what it entails, please let me know. Also, you can just email me, or you can reach out on Facebook Messenger and connect with me there. I'm more than happy to walk you through what this position is and what it might look like for you. Oh, there's Madison's little one. Hi, sweet girl. Oh my goodness, that hair. So I would just like to introduce Jenny to you all. You may know her already. But Dr. Jenny Beaver is the president and CEO of Fourth Trimester. She's our fearless leader. And so you get to have her for the West Valley until someone else steps into this role of leadership for your gatherings. And so Jenny, I'm just so thankful for you being able to step into this and for taking over for me here. So thank you for coming on the call. If anyone has any questions for Jenny, you can absolutely ask her. Jenny, do you want to say anything about what's coming up?
Sure. So I just want to, acknowledge Sarah for the amazing, always energetic and bubbly and happy and wonderful work that she's done with all of these villages, especially West Valley. She's wonderful, and we will miss her so much. Perhaps I will miss her the most in this particular position. But yeah. I mean, no one can take over and be Sarah, unfortunately, but we will do our best in the interim. And we're really hopeful that we're able to find someone who has a heart for this work and who wants to take over the West Valley Village lead position. And kind of do what Sarah's doing, in your own way, but moving forward. So if you have any interest in that, especially if you're from the West Valley, that would be really perfect in terms of what is required. And we're looking for someone who has between 6 and 10 hours a month. That's mostly what's required, and likes to come on Facebook Live and chat and talk with moms and babies. So yeah. Thank you, Sarah. And yeah, we're looking forward to more. And I'm going to have to channel her probably next month to be as awesome as she is, but I'll do my best. Yeah.
Well, thank you. It's certainly been a blast to be on here and meet so many amazing people. I mean, I've met some of you in these groups and just feel like I've gotten to know you guys. And so it's been really a blessing to me to deepen those relationships even outside of these gatherings. And that's really my heart for the West Valley and for really all of the villages that Fourth Trimester kind of cultivates within Arizona, is that there would be leaders built up from among the local community that can start to speak to that community from a heart of caring for that specific location. And so that's really, really what I want to see happen. So please do reach out to me, to Jenny, to the organization at large if you have any interest in doing that. And even if it's not for the West Valley, there are a few more lead roles throughout the state that are being built and are also being looked for. And so there's many opportunities to serve within this organization and really give back things that you've kind of retained from these gatherings, but also just that support that you have felt. This is an amazing opportunity to give back to your community, to be a part of it in a bigger way, to bring more people in to the fold. We call these villages because that's what they are, right? It's the people that live around us, that care for us, that support us, and us them, right? That's a village. And so we all know that we need this support, especially in the postpartum. And so that's really what we want to see built. But we want to do that in that hyper local sense that, you're knocking on your neighbor's door like, hey, I don't know you so much, but I saw you come home and I saw your baby girl balloon in the driveway. And congratulations, and here's some carrot sticks and peanut butter, and is there anything I can do for you? That type of feeling. And we just want to come together and really help to cultivate those in all of the regions in Arizona. So with that today, I want to thank you all for being amazing attendees to these gatherings. Thank you, West Valley, for everything. You are amazing. You have so many resources out there that you have no idea how impressed I am with the West Valley. Really, you guys are amazing. I hope all the best for you and that you continue to just network and communicate so much, even more so than you do now. Just a beautiful community out there. And then we cannot forget to thank Maddison one more time for being here with us and for sharing her wealth of wisdom, really on midwifery care and home birth in particular. Maddison, I might just have to have another baby and move to, Central.
You might just have to have another baby.
Yeah, so if anybody wants an older child so that I can then have another one, because I can't have 6. I can't. My cap is 5, so you get your choice of mine. That's the only way.
I always say I'll take on anytime.
I know that's true. So I already have my out. All right, Madison, I'm calling you out. If it's cheaper than having a birth in the hospital, I'm sold. Joking. And thank you, Maddison, sweet daughter, for
thank you so much. Thank you. She did so good.
Well, we were talking.
Can you wait?
Thank you.
Can you wait? Oh, what is that?
Yeah.
What is that grumpy face?
Oh, I know. I put you on the spot. All right. Well, with that, let's go ahead and then we will close out our Facebook. Please stay tuned for lots of information about our upcoming gatherings. We will post them in the chat, and let's go ahead and